I've competed in a lot of races for a lot of my life, from open water swims, bike races, some long, some short, to Ironman triathlons, and two things have remained constant. I've never won anything, and my knees kept getting worse. So after 7 surgeries, I said enough.
Your knee was very bad, John. In a category mild, moderate, severe, it's severe with deformity. So that adds another challenge to both how you feel beforehand and your recovery.
Yep, after getting my right knee replaced 2 years ago, I turned in my second knee for a new replacement about 7 weeks ago. Before the big day, x-rays had to be taken, examined, and then the most honest assessment from Dr. Hall.
This one's bad. There's no other cure or treatment. It's one of those, we can let it go and just kind of baby it and inject it, or do the knee replacement, which is the only cure. We're almost recapping the edges of the bone and the cartilage. So we are removing the bad cartilage and bone, and we're doing this through a relatively small window through the front of your knee. As a result, the metal and plastic articulation in your knee is a near normal function to your knee, with the exception of sacrificing one of your cruciate ligaments, which is standard.
The surgery went smoothly, but there was no rest for the wicked. Within 5 hours of getting a whole new knee, they were making me use it. Remember my competitive nature? Well, I was determined to set a record for the first post-op knee replacement lap around the hospital. But by the end, I was just glad to head back to my bed, to rest up for discharge, and then physical therapy.
It's very helpful that you're active. Sometimes that can work against you and you can do too much too soon, but moderation is the key.
So the exercises that I choose, it's more about quality versus quantity. I don't want to wear you out too much.
But that didn't mean that physical therapist Lisa Ann McCall wasn't going to be easy on me.
Be tall, be tall. The other right hip down too. There you go, there you go, there you go. That's good.
For weeks, she's put me through a bunch of exercises, some conventional, some of her own design.
When your knees hurt for many years, you tend to pull up on the shoulders. And that because you're trying to get out of pain. So you're gonna have to relearn how to drop your upper body and trust, dropping your body into your hips and knees. Because if we don't use that knee right, it'll have other problems.
But all of which have given me and my knee a new lease on life.